In 2010, the United States executed one of the largest food recalls in its history. Health authorities traced an outbreak of Salmonella enteritica cerovar enteritidis to a network of commercial farms, resulting in the recall of over 500 million table eggs. The sheer volume of that recall points to a specific biological reality. This contamination did not originate from dirty eggshells or unsanitary sorting facilities. The pathogen is sealed inside the eggs before the shells ever formed. This mechanism is called vertical transmission. The bacteria infect the developing egg yolk while it is still inside the hen's reproductive tract. To achieve this, the bacteria must survive the hen's internal immune defenses, travel to the reproductive organs, and persist long enough to be encapsulated in the forming egg. This creates a biological paradox. The hens that harbor the bacteria show no clinical signs of disease. They carry the pathogens silently, only to suddenly begin shedding it into their eggs exactly when they reach peak reproductive age. The 2010 recall was a predictable biological event. It occurred because the bacteria exploit a temporary hormone-driven collapse in the hen's cellular immunity, known as the point-of-lay crash. The avian female reproductive tract manages two competing demands. It must block ascending cloacal infections from the outside environment while simultaneously transferring maternal antibodies to the developing embryo inside. To do this, the system is strictly compartmentalized. The lower tract, comprising the vagina and the uterus, acts as a fortified front line against pathogens trying to travel up the system. The walls of these lower regions express high concentrations of specialized sentinels called toll-like receptors, specifically TLRs 1 through 7, 15, and 21. When these receptors detect a pathogen, they trigger the immediate release of antimicrobial peptides. These include beta-defensins, known as gallinisins, and ovodefensins, like gallin, which create a highly toxic chemical barrier against invading bacteria. The upper tract, consisting of the ovary and the magnum, operates under a completely different mandate. Its primary function is to provision the developing embryo with the antibodies it needs to survive after hatching. This provisioning is spatially precise. At the ovary, maternal immunoglobulin Y, or IgY, is transferred directly from the surrounding tissue into the forming yolk. As the yolk descends into the magnum, a different set of antibodies, IgA and IgM, are secreted directly into the albumin, or egg white, as it thickens around the yolk. The lower tract enforces a lethal chemical blockade, while the upper tract provisions specific antibodies. This strict geographic division makes a direct ascending bacterial assault up the reproductive tract nearly impossible to survive. Because the reproductive tract is too heavily defended to attack directly, Salmonella relies on an indirect route. It bypasses the oviduct entirely and targets the host's systemic immune cells. Cerovars like pylorem and enteritidis are ingested by the bird and deliberately invade splenic macrophages. Once inside the macrophage, the bacterium is sealed within an internal compartment called a vacuole, where it should normally be digested. To prevent this, the bacterium deploys a mechanical structure known as the Salmonella pathogenicity island 2, or SPI2, type 3 secretion system. This apparatus operates like a microscopic syringe, piercing through the wall of the host vacuole. The SPI2 system injects effector proteins directly into the macrophage's cytoplasm. These proteins physically disrupt the host cell's internal trafficking, mechanically preventing highly acidic digestive lysosomes from fusing with the bacterial vacuole. The host bird's immune system detects the invasion and mounts a Th1-mediated response. It floods the area with cytokines like interferon gamma, IL-12, and IL-18 in an attempt to clear the infection. The result is a perfect biological stalemate. The host's Th1 response stops the bacteria from multiplying and causing clinical disease, but the SPI2 persistence mechanism prevents the host from clearing the bacteria entirely. The hen enters a persistent subclinical carrier state. This stalemate holds until the hen reaches 18 to 20 weeks of age. At this precise moment, the onset of sexual maturity triggers a programmed biological event that shatters the equilibrium. This dual-axis timeline graph tracks systemic and local immune cells between weeks 16 and 24. Exactly at week 18, the onset of lay causes a massive systemic crash. Populations of CD4+, CD8+, and gamma delta T cells plummet simultaneously in both the spleen and the reproductive tract. Looking at the second axis, we see a paradoxical anomaly. Exactly as the T cells die off, macrophage numbers experience a massive, sudden influx, spiking rapidly into the oviduct and ovary. With the T cell populations decimated, the host's Th1-mediated immune response is structurally eliminated. The precise immunological pressure that held the Salmonella in check vanishes. This triggers a Trojan horse scenario. As the hen recruits millions of macrophages to her reproductive tract to assist with tissue remodeling during ovulation, she inadvertently imports the very splenic macrophages that are secretly harboring the SPI2 Salmonella. The local gamma delta T cells in the ovary are suppressed by the hormone surge. Without them, the bacteria are free to exit the macrophages, replicate rapidly within the unprotected ovarian tissue, and infect the developing egg components directly. By infecting the yolk at the very top of the reproductive system, the bacteria bypass the heavily fortified lower tract entirely. The infected yolk descends, gets wrapped in thick albumin and a solid calcium shell, and passes straight through the defensive chemical barriers unharmed. Hens that appear perfectly healthy and disease-free can suddenly begin shedding significant concentrations of pathogens into the food supply, triggered entirely by reaching reproductive age. This programmable immune collapse limits the effectiveness of live attenuated vaccines. Even if a flock has strong systemic immunity early in life, the total collapse of T cells at week 18 creates a window where the pathogen can reemerge and bypass those learned defenses. Because the point-of-lay crash is a natural, hormone-driven event, external interventions like facility cleaning and standard biosecurity protocols are insufficient. They cannot stop an infection already locked inside the hen's macrophages. Securing the global food supply from large-scale recalls requires shifting the focus away from environmental sanitation. The industry must develop targeted interventions that specifically bridge the 18-week immunological blind spot inside the hen.